Hello, my name is Andemichael. I'm a senior in the molecular biology department. And for my summer project, I expanded on what I was studying for my JP and what I hope to expand upon onto my senior thesis of the social determinants of COVID-19. So first, I kind of want to just describe what I mean by health disparities, not only in COVID-19, but in other diseases as well. First, I want to discuss inequality. So this can be economic or social inequality, in which case certain individuals are excluded from healthcare based on something even as simple as the zip code that they live in. As this graphic kind of shows, in the United States, it is often the case that the more wealthy you are, the more access and the higher quality healthcare you can obtain. Also differences in condition and rank. So that can be in a healthcare setting where individuals with certain conditions might be treated not the same as others with different conditions. Lack of equality as of opportunity, treatment, or status. So a lot of the times, research has shown that doctors and other healthcare professionals do have certain biases, inherent biases towards different minority groups, for example, in which case they do not receive the best care or equal care as their white counterparts. And also kind of want to talk about inequity and unfair and unjust, unnecessary and unavoidable. So in which case this is kind of talking about more of the economic side of the American healthcare system. So first, I kind of want to talk about why racial and ethnic minority populations are experiencing more severe cases, hospitalizations, and deaths in relation to COVID-19. As researchers define racial and ethnic populations in the United States, we're looking at the American Indian or Alaska Native, Asian Americans, Black or African American, Hispanic or Latino, and Native Hawaiian or other Pacific Islanders. And sometimes we just think about the racial or ethnic breakup, but not only that, there are certain even discrepancies elsewhere, such as socioeconomic status, geography in which someone lives in, so a city versus more in the countryside, gender, age, disability status, and risk status related to sex and gender. This is a graphic produced by the CDC this month that kind of incorporates just how severe the differences in healthcare appears to be for different minority groups inside the United States. And there are several reasons for this, which I'll talk about a little bit later. But as you can see, it covers cases, hospitalizations, and deaths among the different minority groups. And it's stark to see just how much larger these differences are in relation to white non-Hispanic persons. Some of the ones that really stand out to me are the increased hospitalizations among minority groups. This virus is really targeting the most vulnerable communities in this country, and I think it is really highlighting the issues in our healthcare system, and especially our public healthcare system. One of the reasons why there is such a discrepancy in these symptoms in relation to minority and ethnic groups is because of pre-existing conditions, also known as comorbidities in relation to COVID-19. So this can be cardiovascular disease, cancer, diabetes, HIV, AIDS, infant mortality, asthma, and mental health. And as you can see by this graphic, also produced by the CDC, different comorbidities do lead to higher and more lethal symptoms of COVID-19. As you can see, obesity, diabetes, hypertension, chronic kidney disease are very influential factors in if you will be hospitalized for COVID-19. And these how many more times it affects you does increase with each additional condition that you do have. And there are several reasons for why minority groups do experience these pre-existing conditions, which we'll also talk about soon. So kind of what I want to talk about for why we see these health disparities and pre-existing conditions in minority groups. One of the biggest things is healthcare access. A lot of minority groups do not have adequate healthcare access because of where they live geographically, but also because of economic means. A lot of people struggle to get adequate healthcare insurance, which prevents them from getting treated, and these symptoms kind of multiply as time goes on and can lead to more severe symptoms of COVID-19. Another thing is the living and working conditions that minority and ethnic groups do experience. So a lot of the times we do see that minority groups are overrepresented in terms of essential workers. So they are on the front line working, which also exposes them to a higher chance of getting COVID-19 and becoming hospitalized. It also does increase the rate of community spread, as when they do come home, they have the possibility of spreading it to their families and loved ones. There are also some biological differences that do raise some awareness for kind of the issue with COVID-19. One being one study that looked at vitamin D deficiency with severity in COVID-19 symptoms, in which case, for example, African Americans tend to fall under having more vitamin D deficiencies. Just going on, as for other reasons why this is the case, for example, one can be diet. A lot of the times, people who live in minority communities do not have adequate access to fresh fruits and vegetables that will increase their immune system and their overall health. This graphic kind of shows how certain individuals live in food deserts, in which case they don't have access to supermarkets where they can get adequate food, which does decrease their health and can create more severe symptoms of COVID-19. Overall, these are all a combination of a bunch of things that are rooted in the system that prevent minority groups from attaining the adequate healthcare that they need, especially in this age of the pandemic of COVID-19. And what can we do moving forward? I think the first thing we have to do is, and which I'm very thankful for, is that a lot of states are acknowledging the issue that this is happening. We are seeing across the country minority and ethnic groups having an increase in cases and hospitalizations with COVID-19. And one measure that is effective in stopping different pre-existing conditions that we've already studied is increased funding in public health measures. So this can be educating people on certain foods that they should be eating that can help with certain conditions, promoting exercise, vaccinations and so on. Overall, just creating awareness for COVID-19 as far as letting them know that they are at more risk for developing these conditions, and that they should be extra careful in how they should approach wearing a mask, social distancing, washing hands, and other means. Overall, I also do think that there should be systemic changes in policy that can provide more healthcare access for minority and ethnic communities, which I hope this pandemic has shown the flaws in the system and that these will be passed in the future. And I do hope to continue this research into my senior thesis. And thanks for listening.